Good morning, welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We are hosting press briefings in Itasca every other Thursday to address COVID-19 related issues and questions. Today we will discuss schools and sports and staying the course, as well as provide an update on vaccinations within Itasca County, and that will be offered during the question and answer portion of our briefing. Our speakers today include Dr. Jeff Pescha, Superintendent of Deer River Schools, Brad Haidu, Coach, Grand Rapids Greenway Lightning Hockey and High School History Educator for Grand Rapids School District, Annie Olson-Reiners, Principal, Keewatin Elementary School, Angela Elhard, Public Health Nurse and Licensed School Nurse for Independent School District 318, Grand Rapids. And during our question and answer portion, we will have John Pedersen, Interim Vice President of Operations for Granitasca Clinic and Hospital, Nancy Malt, Chief Operating Officer of Scenic Rivers Clinic, Aaron Saudi, Chief Executive Officer, and Angela Cleffman, Chief Operating Officer, Bigfork Valley, Kristen Lynn, RN, Regional Director of Nursing, Essentia Health. Before we introduce our speakers, we'll begin with a situational update. In Itasca, we have identified 35 positive COVID cases in the last 7 days and 69 in the past 14 days. 33 of these cases remain in their isolation period, and our total case numbers in Itasca are 2,930. Our 14-day case rate per 10,000 is 15.7 as of February 1st. And we are again so excited to have vaccines available less than 1 year out since our first COVID cases were identified in Minnesota and in Itasca County. And we know we have a long way to go, but this is an opportunity for all of us to see the finish line in sight. We know that vaccines are very limited and are for certain priority groups, which include healthcare, schools, childcare. And our healthcare vaccinators, they are working on their senior populations. We are not vaccinating the seniors in public health yet, as we are focused on the schools and child and healthcare staff. We are receiving a significant amount of inquiries from residents as well as employers on when they are next or when it is their turn for vaccinations. And what we know right now is the priority groups I just named. The State Advisory Committee for Vaccine Prioritization is working on which groups will come next, but we're so thankful that you're being patient as we work through the priority groups as vaccines become available. We certainly know that demand for the vaccine certainly exceeds the supply right now. We want everyone who is anticipating receiving their vaccine to stay strong, keep wearing your masks, keep social distancing, keep limiting the larger group gatherings. We don't want to lose any of the progress we've made and all the hard work and sacrifices we've made in Itasca to get our COVID cases down. Our schools are increasing the in-person learning, our businesses are opening at a larger capacity, and we want to keep this forward movement. And it's so hard. We know it's hard, and it's hard for us to ask you to continue to do this, but we will get there. Vaccines will eventually be available for all who choose to receive it. Again, stay strong, and we can do this in Itasca. For those of you who are on the fence about vaccines, please do your research now and make your decision on whether or not you will be receiving, so when it is your turn, you can register quickly. We have plenty of information available on all of the healthcare websites. All have frequently asked questions sections. Some have videos with their providers offering information. Please connect with your healthcare's online systems, such as MyChart. Please connect with a healthcare provider if you do not have one, so our healthcare systems can connect with you more easily when it is your turn to receive the vaccine. Thank you again for your diligence in keeping COVID spread to a minimum. And I'll now introduce our first speaker, Dr. Jeff Pescha, Superintendent, Deer River Schools.
Well, good morning. A lot of optimistic information to share within the Deer River District boundaries. We're probably at our lowest case rates that we've had all year, or at least all the way back to the beginning of the year. And we're very, very thankful. At this point, or by the weekend, we will have 100% of our staff that are willing participants in vaccination have received their first dose. And that's, one of the most exciting things that, has happened here in a while. So with that, our school board had a work session last night, and I don't want to put the cart before the horse, but on Monday at their regular meeting, anticipate that they will pass a resolution to shift our learning model. So we've been in hybrid for 91 straight days as of tomorrow, and we'll be looking at February 22nd that we will be offering all day, every day in-person instruction for our students in grades K through 5. We've already had 6th graders back every day since January 26th. And then we'd be looking at March 8th, being able to offer daily in-person instruction to students in grades 7 through 12. Under the current executive order, we're required to give our teachers 2 full prep days to get ready for the transition. So there will be no school on the 12th and 19th of February in the Deer River schools. And our school board is also committing to continue to offer our Warrior Online program to any family that would like to continue that through the year. So regardless of whether the executive order changes or not, that's currently requiring it. We're committing to keeping that option available to the families that want to continue to take extra precautions to protect people. So, and I know just in general in the Itasca County area with the other schools, they're all in various stages of returning students to offering an in-person option. So lots of great news on the school side.
Thank you. We'll now hear from Brad Hyduk, coach, Grand Rapids Greenway Lightning Hockey and high school history educator for Grand Rapids Schools.
Good morning, everyone. Just speaking from maybe more the sports perspective, I know the schools, obviously, we're hearing frequently from our leadership. Beginning on January 4th with the renewal of interscholastic athletics and high school sports. One of the unique things about sports is that it offers a challenging environment with regard to COVID and infectious diseases. Just like we know from years past where flus and sicknesses can go through teams pretty quickly. Teams are in congregate settings frequently. That's obviously an altering that all coaches have had to make to adapt and make sure that we're able to pull off sports successfully. And I can tell you that just looking across the state, really, all sports, not just hockey, boys, girls hockey, basketball, wrestling, swimming, and across the board that so far so good. Obviously, we've seen the progress at the state level with regard to where COVID is and vaccines rolling out. And that's now reflected in sports and fewer disruptions. If you remember, as sports were shut down in late November, just as playoffs were heating up with some of those fall sports, obviously case rates were at a place where it just wasn't viable anymore to be able to host sports safely. And through November and December, that shutdown, obviously through the holidays, has allowed us to have a successful start now a month into our season. In fact, exactly a month into our season now. So here locally, as far as the girls that I coach, high school girls, it's a change of what they're used to. The locker room is the place that kids really look forward to every day, and we obviously have had to change the way we approach that. 50% capacity, obviously the masking, using the hallway space, having pods, but it's really worked well. And now that we've been playing, 2 nights a week, what we've learned is every place kind of has their own protocol. And we've seen maybe in the outstate things that look a little bit more like Grand Rapids. We've seen as we've headed, for example, to the Twin Ports, a little bit more restrictive in policy that might mirror some of, maybe the metro area. I think all with the goal of being safe, but that's an adjustment that we have to make on a game by game basis. So I think our girls have done a wonderful job, constant reminders, obviously. And I felt like our visit to Duluth, for example, where at the Heritage, the protocols were quite a bit more strict than we've seen anywhere else, was a good reminder that, we're not out of the woods. And, like Coach Chido and I talked about prior to the holidays, staying the course is going to be really important. And like you said, so far, so good. We haven't had a positive case within our group. And we've had a couple of negative tests. So kids are being precautionary about, doing their diligence. And, if they're seeing symptoms, they're doing what's best for the group. And so, again, we're thankful that so far, so good. And I've got a sore arm today because teachers and coaches are being prioritized. So maybe a little sooner than I even expected. I was excited to get my first vaccine shot yesterday. So, that's good for all of us and makes it obviously more likely that as we continue on to the spring. And I'll just say lastly that the State High School League is meeting today, their board of directors meeting, and they are laying out their postseason plans, which includes a state tournament for all winter sports. And so we should see some evidence of that. And even that is going to have precautions, unlike, obviously a normal year with obviously fans and those things. But the fact that we're having that conversation is obviously proof that what we did back in November and December is paying dividends now. So thank you, everyone, for having me.
Thank you. And we will now hear from Annie Olson-Reiners, Principal, Keewatin Elementary School.
Hello, good morning, everybody. Today I am joining you from our school where we have approximately 350 preschool through 6th graders here with us today. We are in person every day, K-12 in Nashwauk-Keewatin right now, and we have every other Wednesday for a play as the superintendent from Deer River had shared. Teachers do need a planning day by state requirement. So we do have every other Wednesday that is a planning day here, but otherwise our kids are here. And today we're gonna have a fire drill. And it looks a little bit different with COVID protocols. Kids are doing phenomenal with masking, really very seriously. Everyone's taking it really. The chance for us to get our kids back in person has been awesome. I think some of the things, obviously, we know our best learning, especially for our young learners, is done in person. And a big part of that is about relationships. So when we can have kids together, connecting with their teachers in the same space, face to face, when they can be connecting with the other kids in their class, a lot of learning happens between learners at school and not just with the teacher. And we know that our digital learning or our online learning has worked in a pinch, but it's not what any of us prefer. We are also able to connect our kids with resources here at school. So our school counselor, our school pantry, our district nurse, all of our mental health practitioners that work in collaboration with the school too, are able to support our students. So having the kids in person for learning is such a phenomenal change. And we also get that like dopamine hit from spending time with kids and students and being able to really be present with them in their learning without that the digital lag and the screen between that relationship. Another thing that I wanted to share is just a specific situation. We have several students who receive special education services, and many of them were able to receive service even when we were distance learning. However, we were not seeing as many gains, especially for this one student that I'll share, for a child who had chosen to be a virtual student for Q1 and half of Q2. And now that student is back in person, the case manager told me just yesterday that they are making progress with those gains and they're having a much more positive outlook about school. It's been a transition, of course, getting kids up early, getting them out the door, getting them on the bus, getting them into school. And there was a little bit of return to school anxiety those first couple days, but otherwise it's joyful. We have really joyful jobs in education, and it's so much more fun. We have the kids in for us. So thank you for sharing your kids with us, and thank you for trusting us to make the best choices for their safety during the day.
Thank you. And we'll now hear from Angela Elhard, Public Health Nurse, Licensed School Nurse, Grand Rapids Schools.
Good morning. Thank you for having me. Just wanted to share from the nursing perspective in the school systems. We in Grand Rapids have had about 248 cases when we look from September to the present. And what we're seeing in our school system is our activity is starting to increase. And that is normal with our COVID beast that we're dealing with. As we bring kids back together, we will be completely in-person learning for everyone. Starting on Monday, we are bringing our final school back. So with that comes, I want people to realize that just because we're coming back in person does not mean that things are back to normal. We are still in the middle of a pandemic, and we know we will continue to see increasing numbers. And so what we need to do is to manage it the best we can. And part of that is reminding people of our mitigation strategies. And I think one of the most important ones I can see when we come back to in-person learning, where we can't always maintain that 6 foot of distance, is proper masking protocol. Making sure the masks are worn correctly above the nose and below the chin, and even consider, more layers, 2 masks, 2 or 3 layers of your mask. I think that's going to be very important in the schools, and to be diligent in that. I also just want to let people know that another important mitigation strategy that we're really pushing is stay home when you're sick. And I know we're tired. We've heard that. We have been following that protocol since the beginning of the year, but it is really important. Even illness that we normally go to work with or to school with, please stay home when you're sick. Also, I just wanted to share that another important mitigation strategy that we use in schools is when we have a positive case, we do contact tracing and quarantining. That means we find out who are the close contacts and we have them stay home. That is a mitigation strategy, not a punishment. I don't want people to think that is something that is a bad thing, but it is a good thing because we're trying to slow the spread in school. One of the things we're watching for, or a number of things we're watching for that might increased numbers in school as well are the variants that we see popping up around the United States, and also the travel that might happen over spring break with students and staff and families. So we got to keep an eye on that. And that's all I have. Thank you.
Thanks so much. And we will move to the question and answer portion of our briefing. And just note a couple of our speakers had to jump off, get back to their classrooms and their school days. But we do have John Pedersen, Interim Vice President of Operations, Granitasca Clinic and Hospital, Nancy Malt, Chief Operating Officer, Scenic Rivers Clinic, Aaron Saudi, Chief Executive Officer, Angela Cleffman, Chief Operating Officer, Bigfork Valley, and Kristen Lynn, RN and Regional Director of Nursing from Essentia Health. We do ask the media to submit your questions in the chat box with your name and the organization you represent. And while we're waiting for questions to come in, we'll hear from each of our hospitals on where they're at with vaccination. John Pedersen, let's kick it off with Granitasca.
Sure. Thanks, Kelly. So Granitasca is part of mHealth Fairview, and we are now getting our vaccine supplies from mHealth Fairview. To this point, we've vaccinated 1,003 healthcare workers. And we're excited this week to be able to have the opportunity to start vaccinating our 75 and plus up population, including healthcare workers in that group. Currently, we're working with all of our patients trying to get communications out on digital media. We're sending a mailing out to the group. We're currently vaccinating the 75 plus. And we're also working on other avenues where we can text and communicate with patients via MyChart and email. Transitioned from that regional healthcare supply. We thank them for all the work they did with us and getting our supply now from mHealth, and they've been excellent to work with and are giving us an appropriate allocation. And we know the demand for the vaccine remains high. We're continuing to vaccinate patients, including those phase 1 patients, and we will keep moving our scheduled cadence. We're trying to get that communication out every Monday morning, and we'll continue that until the supply is full.
Thanks. And we'll now hear from Nancy Malt, Chief Operating Officer, Scenic Rivers Clinic.
Good morning. Thank you for having me. I represent Scenic Rivers Health Services, and for those of you that don't know, we have 6 medical clinics across rural Minnesota. We're a federally qualified health center with medical clinics in Bigfork, Big Falls, North Home, Floodwood, Cook, and Tower. We've been collaborating with Minnesota Department of Health as a federally qualified health center, better known as an FQHC, and they are allocating vaccine to FQHCs across the state. So we have been able to work through our patient list of 65 plus, and now have been given the opportunity to expand it past our patient population. And we are accepting folks from the public that are not our patients. And with the specific age group of 65 plus, we're not able to help the educators at this time or the essential workers. But we definitely are helping the 65 plus, and our schedules are filling very quickly. We do feel confident that we're going to continue to get vaccine on a weekly basis based on our requests. And so we can take patients from the outside. And if there's anything that anyone has questions in that regard, I'd be glad to answer.
And we'll now hear from Aaron and Angela from Bigfork Valley.
Thanks, Kelly. Bigfork Valley has been vaccinating as well. We receive our supply through our hub and spoke model. So currently we don't really have a supply of vaccine for our first dose administration. We are asking our patients to keep in touch with us, watch our social media, call in. We have a number and a answering machine too, where people can leave their name if they're interested in a wait list for when we do have vaccine. We are lucky, I guess, in that Scenic Rivers is attached to our facility. So our patients and community are able to access that allocation of vaccine through them. But we continue to collaborate with other health systems, including public health when we can, to assist with getting vaccines into people. I don't know if Angela has anything else to add.
I think you got it all. Thank you.
All right.
All right, and let's hear from Kristen Lynn, Regional Director of Nursing for Essentia Health.
Hi, thanks for having me. We, similar to the other sites, are just working on vaccinating, really as many people as we can, starting with that priority 1A group. We have started the 65 and plus as of last week, I think. And, like everywhere else, we don't find out what our allocation is until like the week prior. So it is kind of a juggling act with the schedule and trying to make sure we don't overschedule our patients based on what our next week's allocation is going to be. But just continuing to vaccinate. We have a system up and running over here in Deer River that we can accommodate a lot of vaccines. So we are just hopeful from the state that we will continue to up our allocation and keep getting vaccines out there.
Thank you. And we'll move on to the chat. Kathy Lynn, KOZY, when vaccines do become available, will there be mass vaccine clinics at somewhere large, such as the Civic Center? And I will take that one. We are planning for that. We've been planning for that for weeks and quite honestly, even years in anticipation of a pandemic. What we don't know is, as everyone said, what our vaccine allocations will be and how many of the smaller priority groups will get through first. And so depending on if it's a phased rollout or if suddenly we receive thousands and thousands of vaccines and can just make it widely available, those are some of the unknowns, but we are planning for it should that occur. Greg Grell, WDSE, to any of the clinic providers, when will vaccine distribution move from phase 1A phase 1 patients? Are you anticipating that happening soon? Who would like to take that? John, do you want to answer that one?
Yeah, I can talk through at least what we see. So at Granitasca, we know we're doing the 75 and plus right now from our patient population. And we know that population is about 4,200 within our area that have seen us in the last 2 weeks and are active within our system. This week, we're able to do 332 of those patients. So if you do the math and you think of second doses, we're going to be in this work for a little while until those allocations go up. I think the encouraging thing for us is in the last 2 weeks, the state allocation that they've received from Moderna and Pfizer has gone up 30%. So we're seeing, those numbers increase with us. Now, obviously, we're in the hundreds right now, so it takes a while for those numbers to really build up. But I think it's encouraging that we're seeing that trend.
All right, and I see Kristen nodding, so I won't ask for any other comments on that one. Kathy Lynn, KOZY, Kelly, it sounds like there are at least 3 different vaccine distribution systems, state, county, and hospitals and clinics. What is the best way to get to the top of any list? Great question, frequently asked question. I'm not aware. It sounds like Aaron said that there is some lists happening in Bigfork Valley. I'm not aware, and any provider can correct me, that there are lists happening right now because we're focusing on our priority groups. We are meeting in Itasca County, our vaccinators, hospitals, clinics, pharmacies every week to update each other on where we're at and where we're going and what we know about our allocations. And that's really provided a good collaboration. For example, we're in public health focusing on those schools and childcares and any outlying phase 1As. All of us work together, hospitals and pharmacies, on getting those groups done. And now The providers are all shifting to the senior population, and we're gathering some of those phase 1As and the schools and child cares with our allocations. We are not taking waiting lists right now in public health. When we move on to a different priority group, we will have registration opportunities. We'll announce what the next group are with these briefings, with our written media releases, and then all the hospitals have their own mechanisms for contacting their patients, whether it be phone calls coming in, whether it be MyChart, whether it be automated messaging, whether it be letters in the mail. All of them are working through that. And I would welcome any other comments on that from any of our providers.
I would just comment that we aren't keeping any lists either, but we certainly are taking appointments. And if you go to our website, www.scenicrivershealth.org, it lists the contact information. We do have vaccine to distribute right now for next week, and we are taking appointments, so certainly the public can call.
And I would just add the work that, we're doing with public health, Kelly and Elder Circle, we're really trying to make sure we're reaching this population. We want to make sure that everyone's included and has access to a vaccine when it's available.
I was just going to add that we are still adhering to, state guidance on those tiers. So the list I mentioned obviously adheres to that. It would be our 65 plus population at this time.
And this is Kristen. If I could add, if patients out there create a My Health account or chart through Essentia, that seems to be the most streamlined way. Once you are selected to be contacted, we have identified that there are a lot of people in this population that, that just isn't in their wheelhouse, my health. And sometimes phone calls are confusing too. So trying to do a lot of direct outreach to this population right now too, to make sure that people aren't missed, that maybe are, not comfortable with an automated message on their phone or the My Health thing. So.
Great. And I will add, this is preliminary, but we are going to be working with Elder Circle on streamlining some of this work for our senior populations as well. And so that is in the works for when we move up beyond the schools and child cares, at least for public health. So they're a great resource. We have 3 minutes. Any other questions? Okay, seeing none, thank you all for joining us. Stay well.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Biofor stands for. Paper is true Biofor product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Biofor, beyond fossils.